Hi everyone, thank you for joining us this evening. We have a really interesting live tonight with Tamsin O'Brien. She has her pain clinic, which you call it rehab clinic, Freedom Vet,
a vet rehab clinic.
Vet Rehab Clinic.
Yeah.
And she is joining us this evening. And we always love lives when there's photos and stuff to discuss, because a lot of people watching will be able to relate to some of the photos that you're going to show this evening. And I think it's just really useful, because people will be like, but my dog does that, and I didn't even think that was a problem. Maybe I should be listening more. Maybe I should be looking a little bit more into what they're doing. So yeah, it's going to be really interesting. We're going to share the PowerPoint presentation the best we can. I think it will be absolutely fine.
This is like the most challenging bit.
Yeah, exactly. Flicking backwards and forwards from the presentation. But before we go any further, I just want to say once again, as we always do, thank you so much to Big Barker, who are sponsoring all of our lives this year. Everyone's heard it before, and you know that we love these beds, and we talk about them a lot on the Facebook page. I mean, you don't need to look very much further than this video just to see how happy these dogs are on their lovely big beds. And so many people then at the end or through the live say, oh yes, we've got one. And there is always that competition on the Facebook page to win one of these as well. So keep looking. And if you have any questions about Big Barker beds, then please do let us know, because we absolutely love them. So first things first, I am going to hand over to Tamsin and ask her just to tell us a little bit about herself and how she got to where she is now. And then we're going to proceed. And as usual, if you have any questions as you go through, please pop them up and we will come to them either at the time or afterwards. And just try and really help you and get the most out of this. So thank you, Tamsin, for joining us. Would you like to just give us a little brief history about yourself?
Yeah, brilliant. Oh, well, thanks very much, Nicki, for having me. So yeah, I qualified as a vet from the University of Bristol in 2002. And my first 10 years in practice were sort of mixed practice to start with, and then general small animal practice. And sort of during that time, I got interested in acupuncture. And then I was lucky enough that life sort of got me into just being a rehab vet for the last 11 years or so. And I set up Freedom Clinic about 5 years ago, which is sort of what it says on the tin, really. It's sort of all about freedom. And in those terms, I'm sort of generalizing, saying freedom from pain and freedom to move, which is that's what it's all about for dogs, isn't it, really? So I mean, I guess it's kind of handy to start with a sort of rough definition of what physio and rehab is, because I think sometimes, I mean, all the dogs that I see get referred to me by first line vets or referral vets, and I think sometimes people aren't quite sure what they're coming for. But I guess it's a sort of a rough definition. It's dealing with health problems, and in this, musculoskeletal problems, but dealing with health problems using physical techniques, and that can be all sorts of different things, which I'll talk about as we go. So shall I get on to my slideshow?
Yeah, let's do that. I'm going to add you so I can see the slideshow.
Does it look all as it should be?
It is as it should be, and we're not on the screen. It's just the slideshow.
Okay, brilliant. So I thought, well, I knew that I was going to be doing this Facebook Live a few months ago, and I sort of thought, well, it's quite a broad topic, seeing as about 70% of the dogs that I treat actually have got osteoarthritis.
Have they?
Okay. Yeah, I mean, it's not always the primary reason why they've been referred to see me, but I'd say that in the majority it is. So I see it all the time, and I was thinking, well, what interesting points can I bring to the table that is sort of might be slightly different, or looking at things from a slightly different point of view to what's usually on these Facebook Lives. So I decided to just sort of take a few pictures, sort of observations that I've made over the last few months, and hopefully it will sort of spark some interesting discussions about all sorts of things. And then if people want to write in and add their input as well, that would be fab.
Yeah, that'd be really good.
So let's see if I can actually.
So when clients come to you for their first appointments, are you what sort of things do you go through with them? Are you talking about?
Yeah, I mean, usually I've read their full clinical history. I've had maybe an outline from the vets, seen the x-rays, you know, there might be some MRI results or something like that.
Yeah.
And it's the same as what you'd get with most referral clinics. I watch the dog move, examine the dog. This is quite fitting because we come to this slide, which is sort of the start of the examination, and then sort of come up with a strategy of how to improve mobility and reduce pain through many, many different techniques, which, you know, it depends on the dog, but it could be hydrotherapy, acupuncture, chiropractic, massage, joint mobilizations, could be your electrical tools such as laser or ultrasound, you know, the list goes on. And I mean, that's the interesting thing about, you know, there are lots of different ways to achieve the same goal. So, you know, for example, if you're living out, you know, where you haven't necessarily got access to lots of different therapists, then it may well be that you find a therapist that will help you achieve your goal, because there are so many different ways of getting to improve mobility. So physio is such a massive topic, and it can look different in so many different ways. So yeah, it's like there's more than one way to help an arthritic dog, I guess. And just small steps, or, you know, a little bit of something can help. But yeah,
and I think you said that most of the dogs that come in, or not most, but some dogs are already on medical or medication.
Exactly. And that's a really important part of it, that, you know, most arthritic dogs that I see are already on pharmacological medication, and, you know, most of them need to stay on that, so it's not a replacement for pain relief. You know, osteoarthritis being a progressive disease, you know, the disease process isn't necessarily, it's not going to be getting better. The best we can do is maybe slow it down. So and again, we'll probably talk about how you know, we can't always fully understand what they're going through and how they're feeling, especially, you know, if they're a stoical Labrador, or they're programmed to not necessarily show overt pain even if they're feeling it. So I do think the pharmacological pain relief is obviously crucial. And, you know, sometimes we'll get into a discussion with the first line vet about, do we need to add in another one, or, you know, that sort of thing. So most of them will be on pain meds when they come and see me anyway. So, and, you know, but yeah, so going back to this slide, so it's kind of like, I mean, sometimes you might look at, you might, a dog might arrive into the consult room and flop down on the floor like this, and it's sort of cute and endearing. You think, oh, does she want a tummy tickle? You know, is she just being cute? But, you know, if you look at her closely and look into her eyes there, she's actually thinking, oh, please don't touch me. You know, I'm quite sore. And I know that usually this scenario leads to someone touching me where it hurts. And can you please not touch me? So I've sort of become more and more aware of that. And then, you know, it becomes an anxiety problem as well. So I'm always aware that this is one of those sort of, I mean, maybe it's obvious, but one of those signs that's not an obvious sign of pain. So it's, I mean, sometimes I sort of talk to people about pain, and they sort of say, well, the dog doesn't cry, and, you know, he's not limping really, obviously. So, you know, there's no obvious signs of pain, but, you know, that, as we know, there are so many different ways that they might express pain. And we can't always know what they're feeling. So, that was
it's such an individual thing, isn't it? Interpreting your own dog, or each dog, and you as an owner know your dog better than anybody, so you're probably going to interpret the way they sit, the way they act, better than anyone else. And it, like you say, in that photo, on first looks, it may be, look, I've laid down, come and tickle my tummy. But if you're looking a little bit more closely, then you can see actually that's probably the worst thing that you could do for that dog, because it would only just instill fear and back up the fact they didn't want to be there.
And then she'd sort of have a negative association with being, having a therapy, or, you know, going to that, coming to the clinic and all that sort of thing. So it's just sort of knowing when you need to examine closely, and knowing when, you know, well, you know, you can be a bit hands off about things as well. So anyway, so moving on to this next slide here, which is Seamus, the most beautiful border terrier in the world.
Is he yours?
Yes. And so he, as you can, I've got the two contrasting pictures of him. So, I mean, obviously, he doesn't actually have arthritis, but what I'm talking about can sort of apply to your arthritic dogs as well. And so we've got the picture on the left where he's sort of looking quite relaxed. He's at the beach. The wind is blowing in his beard. It's all good. And then it's sort of, he's got the picture on the right where he's looking pretty miserable. I mean, in that picture, he's looking miserable because because it's raining and he's wearing a coat.
Right. But he doesn't like his coat.
Right, exactly. But that's also the similar sort of facial expression he gets if he's having a flare-up of his inflammatory bowel disease. Yeah, and I've learned a lot about these sort of subtle signs of pain since I've had him, because he does get flare-ups of gut pain quite often. So I've sort of started to like really know how to characterize when he's having, you know, in the early stages of me having him, it was sort of, these signs were extremely subtle, but now it's really obvious to me if he is having a pain episode, but before it gets bad. So I sort of know if I need to give him some meds to relax his guts quite early on. And he's, you know, he does a really slow blink, and he sort of, he stands with his neck sort of very flat, and his upper eyelid takes on a very sort of flexed appearance. It's a bit like that in that picture. So it's kind of like, I've sort of found it, having him being quite an interesting learning curve as to how, you know, the subtle signs of pain. So it's, you know, it's the kind of thing that you might, if you know that your dog's having a bit of an arthritic flare up or an episode of breakthrough pain, then, you know, sort of making these close observations about what they, you know, their posture and their face and their eyes when they're going through something like that could be handy to spot a future episode, or, you know, might be a good indicator that it's a good time to go and see your vet, you know, about some extra pain relief or something like that. I mean, I know in horses they've been developing an app which recognises severe pain in horses' faces and postures. But they usually, I think with that one, they get the person to hold the phone near the horse's face for 2 minutes and to hold the phone to look at the whole posture for about 5 minutes. But it's the sort of thing, obviously, there are lots of sort of different ways of sort of gauging pain, like your clinical metrology, like your pain scores and everything are really handy. But there might be some ways that you can just have a bit more of a sort of idea of it as well, just from observing facial expression and body language. I mean, most people get a good feel for, you know, somehow your subconscious will often sort of process what they're seeing, and you know that the dog's not quite right. But sometimes it's handy to characterize those signs, if you know what I mean. So, and
do you ask your clients to take pictures to send you? Because sometimes it's really hard to describe what the difference is, isn't it?
Yeah, it isn't. Yeah, and sometimes it's actually hard to even see in a picture. I mean, that's quite obvious, but sometimes you don't really see it until you see the dog, if you know what I mean, as well. So your videos can be a bit more helpful, because it sort of, gives you a bit of it's not just a snapshot, but so so I'll move on to
Seamus.
Thanks, Seamus, for that. So moving on to the next slide. So I mean, again, using sort of objective ways of measuring things are very useful in many cases. So for example, if you sort of have access to a pressure plate which can measure the amount of weight going through each limb, that's amazing. But there could be maybe a few things at home that you could do to just sort of gauge if maybe not as much weight as normal is going through that arthritic limb, for example. So looking at this picture on the left-hand side, the Labrador, you can sort of see that through her right hind leg, there's not as much weight going through. I mean, it's kind of difficult to see there, but there's less of an indent. You can see that there's less weight going through that right hind.
Yeah, so you can always appreciate the lean, can't you? Just leaning over.
Yeah, exactly. So it's the kind of thing that maybe if you've got a futon at home or a sofa cushion, it might be that as your little sort of gauge as to how things are going, just sort of see how the dog's standing on that, to just sort of, you know, see how much weight's going through that bad leg. And you know, if you sort of check that on a regular basis, then you can sort of maybe spot a trend early. And it's sort of, again, just knowing what's normal for your dog, what's normal in terms of weight bearing. You know, if they have got a sort of physical asymmetry, i.e. you know that they've got one really arthritic hip, the chances are that they'll always take less weight through the really arthritic hip, but you could just sort of get a bit of a visual gauge as to if that's getting worse or not, if you know what I mean.
Yeah.
But, and so similarly in this picture on the right hand side, this collie is taking a bit less weight through the right hind as well. So it's just sort of little indicators like that which can sort of tell you maybe if you need to just bring your next vet check forward a bit, or that kind of thing.
Yeah.
Or maybe need to tweak the pain meds a little bit.
And probably taking photos is the best way to monitor these kind of changes.
Yeah, definitely. Yeah, exactly. I mean, probably if you're doing this kind of sort of thing, then dogs change posture. You'd be looking for consistency. So it might be that you sort of look at that, and then you sort of get them to change position, and then I'd sort of say if you see it 3 times, in a row, it probably means it's a problem. It could just be that they're just standing a bit wonky if it's just a one-off, if you know what I mean. So but it's just different ways of observing maybe a slight increase in pain, that sort of thing. So this next slide is all about compensations, because really, when as a vet physio or a physio, a lot of the time when you're treating pain or sort of trying to improve function, you often end up treating the compensations which have developed. So so this actually, can you see my cursor? Is that moving?
Yes. Yeah, I can see that.
Oh, brilliant. So so this dog, you can, in the standing picture here on the left hand side, this dog was actually originally referred for a left elbow arthritis. So the lame leg is this left front leg, but if you look there, you can see that all that weight is going down through the right hand side. And what's happened is, because this toe joint here, this sort of medial toe, has obviously taken a lot of pressure, that there's been changes have happened in the bone and the cartilage, or the cartilage and the bone, and she's developed arthritis in the toe now, if you see what I mean. So, this change happened just over a matter of months. So it just goes to show that that's the primary problem, but then actually in recent months, this toe on the other side has become more of a pain problem, if you know what I mean. And you're often dealing with these compensations all the time. You'll often see, dogs who've been x-rayed, their really severe hip is the right hip, but actually they're more lame on the left hip because the left hip's been taking the pressure for such a long time.
It's true. You do see that a lot, and it confuses you, and you have to really kind of play it out, don't you, and work out what the heck's going on. Yeah, exactly.
So, and you can also, it's quite interesting to look from this picture. This is a lying down picture. She's sort of in a sphinx position, and you can't see the whole dog, but you can see that this left front leg is more outstretched. So it's kind of interesting to note that the range of motion that she can achieve is less with that left elbow. Yes, that also is like playing into the fact that she's got such a sort of has been loading that other leg so much, and that there's this kind of real knobbly yoga. So then you end up sort of, the dog her original reason for referral to me is left elbow arthritis, but actually I'm treating the right toes as well, and trying to treat the body to make load bearing be more balanced as well, and to take more weight through the hind limbs so that the front end isn't getting so much loading. So, and we can feel it in ourselves as well. This is like my beautiful feet here. I've got a dodgy left knee, and so I've got a lovely bunion and lower back pain on the right hand side. And it's and like once you feel it yourself, you can understand what the dogs are going through as well.
I totally agree. I've got exactly the same problem, dodgy knee, and when it flares up, you think, oh gosh, it's more sore on this side now because I'm just overloading all the time.
Exactly. And and you need someone to sort you out and tell you off for not doing it all the time. But but it makes you realize how hard it is once your body's in a pattern of doing things in an unbalanced way, how hard it is to get out of it. And it's
the longer you keep doing it the wrong way, the harder it is to correct, isn't it? Because all your muscles start to move differently, and they're all just like contracting in a different way. And it's and I think it's really an interesting one, because I think it's one of those things that until somebody experiences it themselves, they don't fully understand how it might feel for the dog, and it's a real eye opener.
And the thing is, if you're doing it yourself, you don't even realize you're doing it, if you know what I mean. And then you sort of suddenly look at a video of yourself walking and you're like, oh no, I actually limp all the time.
Yeah.
You don't even know you're doing it. And so I mean, part of the physio is often trying to get the dogs to walk in a balanced way again, or sort of more of a functional way, but they sort of will need decent pain relief on board to actually mean that that's not a painful process for them in many cases, if you know what I mean. So that's where the hydro, I mean, some people, in some cases, the hydrotherapy is great for strengthening, but in many cases, it's actually just trying to get them into a balanced pattern again, because they've got the buoyancy of the water is supporting them, and it allowing them to walk in a sort of more of a normal, balanced, 4-beat walking pattern again, rather than sort of really overloading the right side in this case. So so it's not always. It's always going to be an element of strengthening because it's a resistance, but often it will be trying to improve patterns, and then the patterns just aren't ingrained in our bodies, they're ingrained in the neurology as well. So it's there's a lot to unfold sometimes. So.
Yeah, there is, but then once you do that, it makes perfect sense, doesn't it? You just think, obviously this is what we need to do. This is just, but you just have to initially find out why they're walking the way they are, which is the actual problem area. Oh, hello, Seamus.
Is he there? Yeah.
We can't see him on the screen. I can just see him there. But yeah, you do. It does take a little bit of a detective work, really, doesn't it?
Yeah, definitely. So, with these changes with her toes, they really did happen over about 3 months or so, and it just it reflects the it sort of reflects the fact that often changes do happen so quickly with dogs. So sometimes you might have a dog that while you're treating the arthritis for the hips and the elbows, and then actually they start developing slightly different gait pattern in the hind limb, and then you're like, oh, actually we've got a bit of a neurological problem going on here. Maybe we need to check what's happening with the spine. Could be something else going on. Or you've got a dog that's got a gnarly, thick arthritic elbow that's been like that for some time, but then it looks suddenly very swollen and it's hot, and you're like, this could be a septic arthritis. So it's the sort of thing. Things change. It's such an organic process. You don't just have a stiff joint. The body is constantly changing and adapting, and things happen. And it's that sort of that's the thing that I've always found very interesting, is that you'll think in a month things can change dramatically, if you know what I mean. So it's being, if something does seem strange and off, then go and get it checked out, because it probably is strange and off. So
definitely.
So let's go on to the next one. So the next one is all about toes, and I mean, I believe that actually there is a CAM talk about digital arthritis, isn't there? I think.
Yes.
I haven't seen it yet, but I want to see it. It sounds really good. But what I've noticed is that so many dogs with arthritis anywhere else in the body also develop changes within their toes, and it's something that I've become more and more aware of. So I don't know if it's just I've just started noticing it more, and just aging dogs in general seem to get a lot of changes in their toes. So the picture on the left hand side is sort of some beautiful toes. So what we're sort of looking for when we've got lovely healthy dog is the toes acting as shock absorbers. So as you can see, there's 3 bones in the toes, and they're nice, and the tendon that runs up the back of the toes is nice and tight. It's attached to a muscle which runs up the back of the leg, the superficial digital flexor, and so that, which means that when the dog jumps or runs or does anything, there's sort of shock absorption is happening, which will then sort of mean there's less of a load going through that, less of an uncontrolled load going through the elbows and the shoulders, etc. But with age, with loading, with maybe particular overloading because of arthritis in an opposite leg, often we'll see sort of changes throughout the toes, which means that the joints higher up the leg are not being cushioned as well in movement. So you'll often see them manifesting as sort of puffy toes, flat-footedness, or maybe just really knobbly toes. So, I mean, I can't really give a blanket cure-all toe health protocol, but I would say toe health is really important. So if you are seeing a physio, or any sort of physical therapist, then it's worth having a chat about what you can do to improve toe health. I mean, some dogs will tolerate some passive movements and some massage. Not all dogs like having their toes touched. Well, actually most dogs hate having their toes touched. So that's why I wouldn't like just rush in there and start touching your dog's feet, but unnecessarily. But I think toe health is really key. So if you can get someone to have a look and give you some pointers and sort of suggest what you can do to at least delay wear and tear in those toes, then that is a great idea.
Do you find a lot of dogs with digital arthritis, they sometimes will lick a lot of their feet, won't they? And sometimes that can be mistaken for a skin issue, and actually it's not, it's a pain issue.
Yeah, and sometimes if they've got neck pain, I think they actually start licking sort of higher up the. I think sometimes they'll lick their feet if they've got neck pain because it's sort of irradiating nerve pain. Yeah. Or they, often I sense that when you've got dogs with very tight necks, you'll often see them sort of licking up there.
Yes.
So and or they might be licking their wrists, but sometimes they'll lick somewhere and it's not actually the place where the pain is. If you see what I mean, or where the pain originates. So you'll often see that.
And what about nails? Because we talked before on cam about keeping nails nice and short as well. Because you can imagine if you've got longer nails, putting pressure back on those digits, that's going to be really painful as well.
Well, exactly. And then if you have got a bit of a stretch going on, well, if you've got a bit of sort of changes in the tendons at the back of the leg, then or the back of the foot, then a long nail is going to put even more strain on those structures on the back of the limb, if you see what I mean. So so definitely having the nails trimmed nice and short is really important. And also if the dog's already struggling, because the feet help to sort of help with the fine movements and help with the interaction with whatever ground they're on, and then if you've got sort of feet that aren't quite doing what they're meant to do, plus long nails that are sort of preventing that normal function as well, then that can really be difficult. And then going on slippery floors or whatever is even more challenging. And so I think definitely having the nails trimmed regularly and making sure that they're nicely done is very important as well.
I don't think it's something that's talked about enough. We always talk about shoulders, elbows, hips, that kind of arthritis, but we don't really talk enough about the digital arthritis. And it is you can imagine that you're walking, these are the first things that touch the ground. It's probably excruciating if it's
exactly. And it's the sort of thing, it just the more you look for it, the more you notice it, if you see what I mean. So it's kind of, often you'll sort of see in middle age dogs will just start to look a bit flat-footed, and that, to me, that sort of shows that those flexor tendons that run up the back of the foot and the back of the limb just aren't quite working as well as they could be, and that there's probably multiple reasons why that could be. Maybe they're just not as in good shape, or the muscles aren't as well conditioned as they were. I don't think there's been any particular research into actually what's happening on a sort of tissue level with those tendons, but what my hypothesis is that probably that there are changes happening within the fibrous structures of the tendons, that maybe the collagen, there's changes in the collagen possibly, which is meaning that they are less flexible. And then I think once you start to get some laxity in the toes, then that lends itself to wear and tear, and then you get changes in the cartilage, and then the body sort of responds by either becoming a bit inflamed or getting your knobbly toes. So it's I think it can't be underestimated.
Yeah, definitely.
So I think things like getting the dogs really at a young age working on proprioception, sort of walking over lots of different surfaces so that they've got really good awareness through their toes, and a good way of sort of maneuvering themselves over different surfaces will help them to some extent. But I think for individual tips, I say the best thing is to probably seek advice from a physio who can sort of give you something that's appropriate for your dog. But
and it's not just exercise as well, is it? It's because I've there was a physio that we speak to quite regularly, and she was talking about boots for dogs as well. And putting pads where you need them.
Brilliant.
Depending on what side it's affected, just try and even it out so it's more comfortable. So it's not just, and physios are very good at helping, aren't they, to create the boots or design what you need to use.
Coming up with sort of random ideas to sort of problem solve that particular issue.
Yeah, it's a good idea.
Yeah.
So what have we got next?
So we've got a bit more about just postural compensations. So actually I'll start with this slide on the far upper right hand side, because actually that dog is the same dog that was featured in the last slide. So she was the one with the very flat footed, you can't actually see the foot here, but the sort of very flat foot on her right front leg. And as you can see, she's really, you can sort of see why that foot has become so loaded, because she's standing, her hind feet are really sort of tucked underneath her because she's got marked hip arthritis. So she's tight through the back. Her feet are sort of more forward than what they would be. She doesn't want to, you can see that she doesn't want to take pressure through those hips. And sort of what's happened is that, the front feet have become overloaded, particularly that right one, suggesting that possibly the left hind is worse. But these things work in mysterious ways. I wouldn't be that simplistic about it, but so the top left picture here, again, this dog, she's got arthritis in the elbows and the hips and possibly other joints as well. And she's the first thing you notice when you see her is that she's tense throughout. She's sort of, her torso and her back muscles are tense, her neck is tense. She's sort of trying to protect herself. She's got a wide stance in front, which is kind of, she's trying to make the weight of her front legs be spread over as wider area as possible. And she's, I mean, most of the dogs in here, they're tucking their hind feet underneath them so that they're not having to take the weight down through their hips fully, if you see what I mean. And then this lower picture here, he's got had elbow dysplasia as a young dog, has elbow arthritis now, and he's showing this sort of typical duck-legged posture, which is not, I mean, not all dogs with elbow dysplasia show a duck leg posture, but it's some sort of a rough guide that some I'll mention. So so you can sort of see he's sort of straight down down to his wrist, and then below his wrist is sort of turned out like a duck, if you see what I mean. So that can be a way of rotating the limb to maybe feel a bit more comfortable. So and then this dog also has got wear and tear on his lower back, which may or may not be related to the fact that he's adopted a different posture because of having dodgy elbows since being a young dog. So you can see this sort of marked curve in his lower back because the muscles there are tensing up to try and protect him. So there's always, I mean, if your dog's got arthritis, they may well have a postural compensation, but I guess it's just learning what's normal for them and sort of picking up if something's changed as well. But I mean, that's, I guess, like looking at these pictures of the whole dog is sort of demonstrates why sort of physio and rehab and all veterinary work ends up being a holistic process. And by holistic, I'm not talking about hippie holistic. I mean, just sort of looking at the whole animal, because actually in most of those dogs, treating their back pain is a sort of a big part of their treatment, even though their primary issue,
the primary problem,
is arthritis in the joints. So it's just like it's always worth taking a step back and looking at the big picture.
I mean, that poor dog, you just think on the wrong floor, he would just have an absolute nightmare. Just looking at that picture, you just don't want him to step onto anything slippery because he's just going to fail.
And that floor is meant to be a bit grippy, but it still looks like it's difficult to get his purchase. You know what I mean? So
it does.
So
with the flooring on the other two pictures, well, especially in that right top picture, that looks like a really nice floor to stand on.
That's really so. If I'm getting a sort of any dog out of the treadmill who's a bit unsteady on their feet, I try and get them onto that carpet as soon as I can, because it's like you feel like they're safe on there, because otherwise you're sort of cringing. You have to have a waterproof floor in the watery room, but you're cringing if they got wet feet and they really find it difficult to balance anyway. So and that's another thing at home as well. I mean, we'll cover it with the next slide, but you've got to be your own dog's occupational therapist, if you see what I mean. I don't think such a thing exists as an occupational therapist you know, I don't think it's a known job title, but I
Yeah,
guess we're all
it should
doing
be.
it. Yeah, exactly. We're all doing it as vets, as physios, as pet owners. Well, the pet owners are the key people who are doing it, and
Yeah.
it's basically meaning finding ways of making day-to-day life easier and facilitating a normal life. And it could be in so many different ways, like, you know, by having a raised food bowl, you know, choosing what flooring, you know, what bed is appropriate for the dog, you know, sort of keeping them from being wet and windy and cold in the winter. So, you know, get snoods and coats are all sort of so very crucial.
Yeah.
So it's kind of, you know, people can be as creative as they like with it, really.
Yeah.
I think one of the key things is just being warm enough and not getting cold and not getting damp, because I mean they've done some studies in humans, haven't they, to show that actually arthritic signs in humans with arthritis does get is noticeably worse, and they've got the statistics to show it's definitely worse in damp weather. So
yeah,
we can try and extract.
It's interesting because I don't know how you find it, but some of the dogs that I see are worse in the hot weather, and then others are worse in the cooler weather, and you just know that that's them.
Yeah,
and I
exactly.
don't know why.
Exactly. Why does their body interact with the weather in that way? Exactly. Yeah. It's true, actually. Yeah, definitely. But
there is no rhyme or reason. It would make sense. And I always think, probably be, and you say, it might be worse over the autumn. And then people say, actually, he's really bad at the moment. Well, it's really hot. He likes the cold weather. His joints feel better.
And who knows why that is, really?
Yeah. It's definitely a thing.
Yeah.
So what's happening with the German Shepherd at the bottom there?
So was she she's got arthritis in multiple sites, but she has started showing some weakness in the hind limbs, and so you know, sort of possibly degenerative myelopathy, sort of as a working diagnosis. So these little feet, these little boots, are sort of a protective measure for that. And then you've got this this boot here is one that's aimed at keeping her foot in the correct position so that she's not knuckling over with it when she's walking. So there are various things out there. I'm sure that people have seen them, which have that sort of function as well. So yeah.
And what about the bands on the one at the top, or not the bands?
Oh yeah. So this is kinesio taping, which I'm sure some of your viewers are familiar with this. It's the sort of thing that you see. You see it in the Olympics, all the volleyball players seem to be covered in kinesio tape.
Yes.
Sort of their entire bodies. But anyway, it's a version of this, and it's a really good at body awareness, actually. Again, I do it, if you're going to have it done, do it under the supervision of a physio. But I find it particularly useful in dogs with weaker hind limbs. And it's a sticky tape, but you haven't got it on stretch, so there's no chance of cutting off the circulation. But it's the fact that the tape sticks to the skin, but in doing that, it slightly lifts the skin away from the connective tissue underneath it, the fascia. And in doing that, it sort of allows, it sort of improves the awareness of that sort of it improves the function of the nerves within that fascia, which in turn improves awareness and seems to just, for a lot of dogs, improve the quality of their hind leg action. So so sort of end up doing that for a lot of dogs with weaker hind limbs, and a lot of them, it does give them a bit of relief, actually. So it sort of helps with body awareness.
That's good.
I've
not seen that being used before.
I found it really useful. So I'm just trying to think the other. I mean, sometimes you can, if it can be quite helpful on a front leg as well, actually, if they're sort of getting a bit stumbly on the front legs here and there, just to make them think a little bit about that part of the limb.
Makes sense. And what about using things like cold and hot treatments? Do you use that to try and bring awareness?
Massively. So I mean, for awareness or just for general treatment.
Pain relief and warming up muscles and things.
Yeah, exactly. I mean, I use a lot of heat packs because, I mean, as I was saying, a lot of the dogs that I see have got neck tension or back tension. So I end up using a lot of heat packs, and just to help relax those muscles, which that makes them a lot more comfortable. And then I guess we'd use ice packs if they had if they had an arthritic joint which they were having an acute flare with, then if it was actually hot and that sort of thing, then you might use the ice packs to sort of help reduce the inflammation there. But generally, I mean, sometimes heat packs can help if you've got a particularly stiff joint as well, and you just want to get a little bit of blood flow into that area as well to help. So but again, sort of I'd use it under the sort of observation of a physio, but being warm enough, or even putting your hands over a tense muscle to try and sort of generate some heat can be really handy thing to do as well. So
little things you can do at home, that isn't it? Just putting your hands
exactly. And you'll probably know if your dog, if you sort of, I mean, it's a very common thing that I see in the Labradors that I see. I go to touch their neck and they immediately sort of flinch like a turtle. It's like if they were a turtle, they would immediately retract their head into their carapace. And it's like so if you're sensing that, then just introducing it, and obviously read your dog, are they accepting of this treatment? But if you just, by putting your hands sort of over the neck gently to just kind of introduce a little bit of heat, even that in itself could be quite soothing actually. So and it sort of goes back to like reading their facial expressions, like are they accepting that? If you can gently introduce some heat and the dog's happy with it, then that could just make them feel a lot more comfortable. But I think I should think heat packing is the one thing that is so simple but seems to sort of produce such a dramatic effect, for a positive effect for so many dogs. You've obviously got to be health and safety about it and make sure that it's not too hot, and test it on yourself, and all that kind of thing. It's usually about the first sort of 10 minutes that are the most effective time of it anyway. It's always worth sort of having a physio talk you through it, but just gently holding it on. And the key thing is just don't put it on too hot. And some of these ones that you put in the microwave become very hot. They can become very hot in the corners and that sort of thing. So you've got to be really careful. But as with most things, if you are happy putting it on yourself and tolerate it yourself, sort of do a guinea pig run on yourself if necessary.
But if anyone's not doing that and would like to, then speak to your physios about it, because it would be really beneficial.
So right, so on to the next slide. So I think we've touched on it already. Hang on, where is so this is there's a couple of pictures here of various techniques that might be used in a rehab program. And as we touched on before, there are so many different ways that you can get to achieve the same goal. And it just depends where you are and what you've got access to. The things that can be classed as physio would include manual techniques such as soft tissue work and stretching, joint mobilizations, electrotherapy such as the laser or the ultrasound. And often, if you see a physio, then they'll give you some homework exercises to do. And that's often really crucial, because if you're seeing the dog for just an hour every week or an hour every 2 weeks, then you can do a lot of stuff, but you're not going to work miracles by being exposed to them for such a small percentage of their life. So, but if the owners are able to do the exercises and the homework, and that's giving them a consistent sort of top up of the effects of that treatment sort of in the week or two between appointments, then will often really make the success of a rehab program, noticeable. So,
I think a lot of people relate to that, because so many people have physio for various reasons as well. And yourself, if you don't do the physio in between your physio sessions, it's a waste of time, isn't it?
And if the physio knows, you can't fake it. So I always like to say to people, so have you been doing your exercises? And they're like, yes. And they're like, which exercise in particular have you been doing? Oh, yes, all the exercises. And you're like, really? Are there any that are more difficult than others? And then and it's like, oh no, it's all fine. And then you think, okay, I think we need to start again and let's go over some exercises.
But I think probably it's one of those things, isn't it, that you should probably be honest with your physios as well and say, look, I only have time to really do one thing properly, so let's just focus on one exercise.
Exactly. And sometimes it is, I guess sometimes it can be over-facing if you go and see a physio and you're basically handed an A4 folder of sort of like 20 exercises, and then you feel like you've failed before you even start. I guess there's a lot to be said for keeping it simple. You know, do one or two things, and if you can do one or two things for a minute each day, it's probably more realistic to get it done, isn't it, really? So
yeah, definitely.
Yeah. But yeah, I mean, I guess that's the way, because there are so many different techniques that can be classed as physical therapy. That's probably why it's quite difficult to do studies about outcomes for, rehab as a treatment option in many diseases. Because actually, how do you define rehab? It can look in so many different ways that if you were trying to do a study in it, for example, I mean, you had the Facebook Live about cruciates last week. So if you were trying to say, 1,000 dogs had rehab to treat a cruciate problem. So it's kind of like, but what does that mean? What technique do they have? There's so many variables that's probably that's why it's really difficult to do the studies in it. But I suppose it's just by being very, very trying to get rid of those variables, isn't it? That's but yeah.
Yeah, because and also you can't. So some dogs aren't going to tolerate things as well as others, and you might find that hydro's better for some.
That's it. And it does come down to being a very individual thing. And actually, some dogs, for some reason, some techniques work better on some dogs, even when the same person is doing it. It's like, I mean, there is an element of individual. There's definitely an element. Every individual has got their strengths and weaknesses, and certain techniques or certain technologies will be more effective with different individuals. And it's, as often is said in these sort of talks, in my hands, this happens, when people are looking at the outcomes of treatments, this is what happens in my hands. Because even with surgery or, what would be seen as like the most sort of conventional of medical procedures, there's an element of individuality about it as well. But I guess with any sort of, and with the machines, whether it be laser, treadmill, water treadmill, and all the electrotherapies, like there's all the fancy ones, like the neuromuscular electrostimulation and the TENS and all that kind of thing. But I guess there's going to be an element of the intelligent application of it. So in that, it's kind of who has assessed the dog, what they've found, and how they choose to apply that technique. So it's just like nothing really is a magic wand, I suppose.
No. And just because you have access to all these things does not mean that you need to go charging in and use everything. No. They're tools, and you pick out what's going to suit you and your dog.
And also you might end up, working with someone who solely uses their hands and actually get the best outcomes from that. So because there's so many variables, but
this Labrador looks very happy with his acupuncture needles.
He is super chilled out. I've got another picture of him where he's like literally lying flat on his side as well, but he does look very happy about that as well. So that's actually two different Labradors there. There's a lot most of the black Labradors featured in this are different. They're all different Labradors, but I just see a lot of black Labradors. So
it's true. There's so many of them with arthritis, bless them.
Yeah, I know, but they're all gorgeous.
They are.
They are. So this is coming on to the last slide, which is Winston, and I started seeing him when he was about 1, and now he's 5, and he has hip dysplasia. But it just goes to show how actually starting to be aware and starting to get some rehab and physio at a young age, if they've got something that developmental like hip dysplasia, is a great idea, because then you can pick up. If I see him every couple of weeks at the moment, but it's kind of, you can pick up if something's changed a little bit. You might just need to tweak his treatment plan a little bit. Maybe he's going to need a few medications to start some medication, that sort of thing. And then you can hopefully delay the sort of progression of arthritis later on in life as well. Highly important if, with the young dogs is their weight, obviously making sure that they don't get fat. But if they do, that they get it off. But it's that sort of maintaining a lean body weight. So important, for the young dogs as well, slowing it down. So sort of developing some good control through their muscles and through their nervous system as well is good. So making sure that young dogs are doing some nice, slow, controlled lead walking over lots of different surfaces and that sort of thing. It's not particularly exciting, but it's probably like the best exercise you can do for a young dog, just to sort of help their body develop in an aware way, so their movements are controlled, and then actually concussion of everyday life is reduced. So and
so would that be something that you would love for all people to do that with their young dog?
I mean, it's so simple. Yeah, I mean, just actually, if you have a young dog, just getting the dog to do some really nice slow lead walking and have a lovely 4-beat slow walking pattern with a head in a nice neutral position, maybe walking over some different surfaces. You could, even set something up, but walk from grass to sort of road surface to well, not gravel, it's sort of going through a series of different surfaces is a good idea, because it's just going to help develop all the sort of mechanisms in the nervous system which help to have sort of good muscle function and good quality muscle function, which then will help protect the joints in the long term. And that's the other thing I'd say about young dogs, is to sort of jumping out of vehicles a lot at any age, but especially when they're young, I really think that does affect the elbows. So I
mean, I panic with my Labrador because she jumps she jumps out of cars, no problem, but she refuses to jump into the back of the car.
Oh, really?
And she's been doing this since she was 2, and she's now 3. She didn't do it when she was really little. But I just think, I mean, I did x-ray her hips because I was positive that she probably had hip dysplasia, and she doesn't. The hips, well, as far as x-rays can tell me, they look okay. But it's just, I feel like already she's telling me, initially your thing is like, oh, I'm so frustrated with you. I just want you to get in and out of the car. I'm just going to pop this back onto just get into the car, you're wasting my time, it'd be a lot quicker if you would just jump in. Actually she's telling me already, I don't want to do this because maybe it hurts, or
it makes you think that, doesn't it? And maybe she's got sore knees, maybe she's got sore back.
I think probably is her knees more than anything. And it does make me think I should be doing exactly what you've been saying, and just trying to make sure. So she's occasionally lame, and I need to do a little bit more of those proprioceptive that proprioceptive work with her, just so that she is strengthening and getting the muscles to do when she's not lame, to do the movements that I know are good for her, rather than it's all too easy just to go on the walk, let her off the lead, let her do what she wants. But she's a Labrador, she will do far more.
Exactly. And it's always the slow stuff, but they never do. They don't spend any time going slowly, so they don't actually have enough time for all the nerve receptors through their feet and all the muscles in their, the sort of the awareness receptors in the muscles, in the joints, in the tendons, are not getting time to fire. So it means they're kind of their natural sort of control and stability is not getting a chance to develop. They need it. So it's like
absolutely. And it's something that I'm very aware of, and I think it's ridiculous that I don't do it, because it would take maybe 5 minutes a week just doing that.
Or 5 minutes a day. Like 5 minutes a day of slowly walking would be great.
So it's things that you just have to try and fit into your daily routine, don't you? Because I think with people, if we all did Pilates, then our posture and our gait would all be much better. Similar
and we wouldn't have these aches and pains. I know that I need to do more yoga, and I know that if I didn't, my back would feel a lot better. But it's just getting in the habit of doing it, isn't it? So
I know. I know. In all those other things that you're supposed to be doing, like meditating and having time to yourself.
I know. It's like there's not enough hours in the day.
No, it's not possible. You have to kind of focus on what's more important for you. So I mean, the young dog thing is so important, because I think a lot of these dogs that do have the underlying hip dysplasia or elbow dysplasia, a lot of damage is already done by the time we find out about it. And by the time we diagnose it. So then it's really important that when you do diagnose it, you don't just go, okay, well, we know it's there, we'll just wait for it to cause an even bigger problem.
They're probably going to, and this whole thing of like, oh, well, they're probably going to need a hip replacement in about 8 years. But see you in 8 years.
Yeah, exactly. Do what you want. Do what you want for 8 years, it's fine.
So I think having some sort of ongoing input is always worthwhile. And then hopefully they can avoid needing a hip replacement. So
exactly. And I have found that more recently, that when we've had dogs that have been diagnosed with hip dysplasia, there was a little bit of a while ago, a good few years ago, there was a bit of a surge of they all had hip replacements. And now actually I'm finding that when they're referred, they're coming back and saying, no, we're not going to do that right now. We're going to try all these conservative managements. And a lot of them are doing really well.
Yeah, exactly. Yeah, a lot of them really do. So and it's worth a go if you can get some good results from that as well.
But I think also the big change from a few or like 10 years ago is that there are more centres like yours and doing rehab. And so before
that's true. Yeah, that's true. That's sort of like 15 years ago, there was hardly anything, was it? So that wasn't really an option. Yeah. No. So
you just thought, okay, what are we going to do? We have to do surgery because we don't really know what else to do, and we're missing the trick.
Exactly. I think. Yeah, totally.
But it has helped. So I'm just going to pull up this comment from Katie.
Oh, yes.
She's just been saying, this makes so much sense. My dog has been doing hydro and started extending her hind limb. Her lower spine was the initial arthritis concern. She had built some muscles in her hind limbs that she had lost by not extending, but one side was better than the other. Then we ended up with a limp on the good side, and she was slipping on smooth floors, never had before, so it was scary, but this now makes sense.
Yes.
Just really the compensatory effects of having arthritis in a joint.
Completely, yeah. And if you think about it, it's sort of all of the movement is just, it's like looking at the Labrador is sort of very stiff. So if you can imagine sort of if you were sort of trying to do some ice skating and your whole body was tense, you're going to find that really hard. It's like, if it was, it's the whole thing. Any activity you do, as soon as your body tenses up, it makes it 100% worse. It's more difficult to do, doesn't it?
Definitely does. Yeah. And I think so. If you kind of say that into the human side of things, when you go ice skating, you feel that, and you have that anxiety. It's kind of like a dog on a slippery floor.
It's exactly that thing. That's exactly the same feeling, isn't it? Yeah. And so you sort of you're holding onto the edges,
Please don't make me walk across it. Please put me a yoga mat down. Please.
And sometimes it gets so extreme that the dog is really getting very anxious about being asked to do that. So that's when you're sort of your inner occupational therapist needs to come out and sort out some flooring and get some toe grips or something. You can get these toe grips. You probably about those. So
so much more you can do now. Also had a comment from someone, I don't know who this is, sorry, but it just says, I'm an occupational therapist and a vet physio. So
wow, that's a perfect combo. Yeah, great.
Yeah. Hopefully you have got some, hopefully you're spreading the word and making everyone into occupational therapists. Who is this one there? We know he has, this is from Angela. It says, my boy, 13 today, happy birthday, has issues with his feet as he's got older. We know he has arthritis in his back, hips and knees. Do you find that the digit arthritis is hardly ever the primary problem?
Yeah, I think that's the case. Yeah, I do.
It just creeps up.
Yeah, I do see it in some, sporting dogs at about age 8. You do see the arthritis changes in their toes, and sometimes there isn't actually any arthritis anywhere else.
Yeah.
But I guess they've had a lot of impact and that sort of thing, over the years.
It's shocking sometimes when you accidentally get a foot on an X-ray and you think, wow, look at the changes in there.
Yeah, exactly. Yeah. Now I've started looking at feet all the time. We all got it. Everyone should always look at feet all the time. But now I've become completely focused on feet. You just see it all the time. It's
No, it's true. It's so true. I think it's just generally that you can say that of arthritis. The more you look for it, the more you see it.
Yeah, exactly. And hocks is another one. The amount of hocks that you just as a routine exam, you're examining the hocks, and there's a little sort of a bit of a on the front of the hock. There's a little bit of a bony curve. They're getting those changes in the hocks. A lot of the time when they've got arthritis in other joints, you think at the obvious places. Elbows and hips are the biggies, but knees, exactly. But wrists, but often this, we spot it.
Yeah.
All over the place, so
I think it's a little sidetrack, but I find so many cats have really sore hocks. Really swollen.
Really? I don't see many cats, but really.
Knees and hocks. Like, oh gosh, that must really hurt. Lynn, our lovely Lynn, she's messaged, I noticed what I thought was a slightly more developed message on Kai's right hand side shoulder. I watched carefully to see if he was working one side more than the other. i.e. leaning on that
Oh,
side while he
yeah.
cocks his leg, for instance. He has weekly physio, and his amazing therapist gave him a good check over and felt a smooth lump just above the muscle under the skin and suggested a vet check. It turned out to be a lipoma after an FNA. It's good to have vets and physios and get, I think she's going to say basically everyone working together. I can't
Yeah, and it is a team effort, isn't it? Yeah, exactly. And that's great. That's the thing of having, if someone's got their hands on your dog on a regular basis, then hopefully these things are going to get picked up. And like, luckily it was nothing nasty. But
and I think when you go and see therapists, you're often spending more time with them than you can with your vet. And so your dog learns to trust them. And they can probably feel more than a vet would.
Exactly. And also the therapist actually knows that dog. So they also will spot if something's a bit off, you know. So if there's if there's a good amount of time with them. So it
is good to work together, everyone to try and liaise and chat to everyone, because obviously you were saying that most of your work is from first opinion vets, isn't it? They get referred to you.
And
then it's nice to be able to work.
Exactly. I'm constantly communicating with, sort of finding little things and thinking, you better go and get that checked, and so it's a constant back and forth. So
really good team effort.
So
thank you so much for your time. If anyone has any other questions, please do comment. I'm just looking at the time, it's coming up to an hour. I'm aware that everyone will be wanting to get off now. But before we go, can we just have, I don't know if top 10 is probably too much, but what are your top 5 tips that what do you feel you say most in your consultations to owners?
Okay. So I think I've got 6.
Oh, let's do as many as you got. Amazing.
Okay.
Yes.
Yeah. Okay. Weight control, staying as lean as you can is really important.
Yeah.
Pharmaceutical pain relief, don't spare. I think people are like, they want to get their arthritic dog off the meds. It's like, oh, well, actually, they probably need the meds, and you don't want to be doing anything that's going to be jeopardizing the liver or the kidneys or anything. But I'm sort of a bit more on the side of, take the meds. And we're actually quite lucky as vets. I was chatting to a friend who's a human GP, and actually it seems that we've actually got more of a range of, we haven't got a massive range of pain relief drugs, but actually it seems like we've got more of a range of drugs than what humans have got to deal with. So it's actually, we're kind of lucky in that respect. I'd say, I think vets are up there on the pain, on the sort of pain beating
nowadays
right now. So I think it didn't used to be the case, but I think so. Take the drugs, keep moving. So even if your dog can only walk for a minute or two, that's an extreme case. Keep some movement going. Don't let the dog just lie down for 16 hours. Keep moving, because that in itself, movement for the joints themselves is going to help with the health of the cartilage. So got within that dog's limitations, keep moving. Even if it's
just be a walk around the garden and back home.
Exactly. Just getting up out of bed, walking around the garden, and then coming to lie down in a slightly different position. The other thing is like heat being warm enough, and having coats in the winter, I think is another key one.
Do you have any favorite coats that you use?
I mean, I really love Equifleeces actually, because they're wicking and they're easy to wash, and they're not too heavy, and most dogs accept them quite well. Some dogs are a bit funny with the legs. I find some dogs, if they've got legs in holes, I find that difficult. But my favorite one is just the one that you kind of just
over the head,
neck bit, you put it over the head, do it up underneath, and it's just so easy. So so that would be my fave. I think the weather beaters are good, I reckon, when it's really raining. But I usually find the Equifleece is good. And my last point is, I get a lot of clients with their very elderly, visibly arthritic dogs who come to see me, and they go to the park and they get comments from random people about their dog who has poor mobility, if you see what I mean. And I think it's a sort of, it's a bugbear of mine that usually if you see someone with a very elderly dog that's obviously got mobility problems, that person is usually doing everything they can.
They're aware,
to make that dog's life as comfortable as it can be. And they're usually on lots of drugs, having physio, talking to the vet on a regular basis, chatting about quality of life, really doing their best for that dog. And they've probably got got their whole house arranged so that the dog is as comfortable as possible. And I think sometimes throwaway comments from other people can be really disheartening for people who are doing their absolute best at what's quite a difficult time anyway.
Yeah.
So that's what I just sort of say is, I mean,
don't judge.
Yes, but it's kind of like, you know, don't judge. And if you're gonna chat to people, maybe share information, maybe point them in the direction of Cam. But I think some people come and they're like, oh, I went out and then someone said this and now I feel awful, and then they actually don't want to take the dog out anymore, which then is even worse for the dog.
Yeah,
so it's just like
making it worse.
So I would say spread the compassion with your fellow dog owners, because like we're all going to be there at some point.
I think it's a really good one. There's a real mix of owners, and I don't know what you. I mean, you're obviously seeing the ones that are very keen to do what they want, all they can. And I totally understand that there are so many limitations to what you can do, and so what's practical for you time wise, what's financially okay for you to do as well, because obviously
absolutely,
but I do wish that, you know, we see a lot of older dogs just coming in for their boosters, really great owners that spend time with their dogs and don't necessarily see them deteriorating. And sometimes they come in and it might be a family member that's not seen them for a year and they've commented. And I had one of these the other week and they said, oh, my sister's just told me that the dog looks really bad, but I haven't really noticed it.
I guess if it's a gradual change, you wouldn't necessarily see it. And
but then they felt terrible. She said, I feel so guilty. I feel awful that I've not been doing everything I can for my dog. And you know, nobody should ever feel guilty, because you can only do what you see and what you know.
Exactly. And it's like everything's like, sometimes it's a learning curve, but no one's intentionally not doing the best for their dog, are they?
No.
Well, not many people anyway. So
And we get this a lot in Holly's Army, which is the owner group that we have. And a lot of people come in there on their second dog because they've maybe been through arthritis with their first dog. And
and they're fully aware and ready to go.
Exactly. And I think, the more people spread the word and just talk about things. I can see Seamus has got a really nice harness on there as well, because harness is a big
he's
thing.
got what's it? A perfect fit.
The perfect fits, one of our favourites. You know, all these little things that make a difference. And one of the nurses I work with, one of the practices, she's just been enlightened by harnesses and realising her arthritic dog just changed the harness. And now I love
like
her.
That makes a massive difference.
Huge difference. And now every time she says, I can't help it, I'm out on a walk and I just have to say, have you thought about a different harness?
That's the kind of communication that's handy, you know. If people spread like positive ideas, that's great. So
it is. But without being judgmental, I totally agree with you, but just try and slide people Cam information or
exactly
the link to a rehab centre. You just had Seamus has just got a message saying hello from Trisha.
Hi Trisha. I can't wait to see you again soon, Trisha.
So I'm going to let everyone get off and have their glass of wine or whatever you need to do on a Thursday evening. Thank you so much, Tamsin, for joining us. And if anyone wants to watch again, obviously you can watch it on YouTube channel or Facebook page. And hopefully we can get Tamsin on again and share some more photos, because it's really useful to see everything in front of you. And I think a lot of people
I find it a lot easier to discuss things that way. It's like thanks for having me.
So thank you everyone for saying thank you. We'll see you all soon. I think we're back next week, so join us and have a lovely weekend, everyone. Bye.